We're joined this afternoon by Dr. Jawad from Clinch Valley Medical Center and talking about some new technology. The hospital now has EBUS capabilities. And Doctor, first of all, thanks for talking with us. And to understand this, we got to know what EBUS is, first of all.
EBUS stands for the Endobronchial Ultrasound, which is a new procedure that we start doing in Clinch Valley, where we use a small scope that goes through the mouth down to the airway. And with the assistance of an ultrasound, we identify the presence of a lymph node or masses that we can sample.
And what conditions would the EBUS technology be able to diagnose or be used most often in?
Usually it's tried to identify enlarged lymph node in the chest, trying to diagnose lung cancer, and in addition to staging of cancer, also we can diagnose other types of cancer. In addition, colorectal pneumoconiosis, which is known as black lung, sarcoidosis, and other infectious diseases.
This technology, how big of an impact does this have on patient care and being able to find those conditions hopefully early?
It improved the patient care in general. In the old days, we used to send the patient for surgery to obtain samples from this area. Nowadays, we save the patient the hassle and the complication that involve that. Also, it helped us to properly stage the tumor, which really have a huge impact on the treatment and what type of treatment the oncologist will be giving them.
And when you're talking about it, kind of how it works, it doesn't necessarily sound that comfortable, but how painful are we talking about for the patient to go through this?
Well, actually, the procedure is totally pain-free. The patient will be under anesthesia. Usually, we use constant sedation. Some situation we use general anesthesia, so patient will not feel or remember any of the procedure.
Any misconceptions that patients may hear about a procedure like this that may be time to set the record straight on and how it really could help them?
Sure. Usually the patient's main concern will be pain and discomfort during the procedure, which we talked about. As I said, the procedure is completely pain-free. The patient might have a sore throat an hour or two after the procedure. The other misconception or the concern is the downtime. Patient in most situations will be able to go back to their work and their normal routine the next day.
You mentioned diagnosing things like lung cancer or black lung. What does this mean for Clinch Valley's capabilities and for the patients that you serve?
It adds a new service that will help us and help our oncology department to identify those patients and have the proper diagnosis, which will definitely help to aid them with the treatment process and plan down the road.
Typically covered by insurance?
Most of the time, yes, it's completely covered by insurance.
Right. Doctor, thank you so much for coming in and talking with us. If you want to find out some more information about Clinch Valley Health Center, you can do so. We've got the hospital's link on our website.